I'm back here from last week from our first episode of the Mental Health and Resilience series. And guess what? I'm here today with my good friend, Terry Bedminster from Refuge Health Hamilton. We'll be having a great conversation today. I will allow Terry to just introduce herself, even though I said her name, but I'll allow her to introduce herself before we get this evening started. Terry?
Thank you, Leo, and thank you for the audience for tuning in. This is going to be quite a casual chat, and hopefully you'll be signing on with us and hanging out with us as we get through some of these difficult conversations. My name is Terry Bedminster. I am the Executive Director at Refuge Hamilton Center for Newcomer Health. We've just shortened our name to Refuge Newcomer Health. And it's great to have partnered with Empowerment Squared in delivering these series of talks, I would say. It will be a good chat, don't you think, Leo?
Absolutely. But before we even get started, I have a few announcements that I will go right into. Last week, I reminded you all that we have to sell 50,000 cookies. Wow. So Tim Hortons selected us as their charitable partner, the one in Binbrook, for their Smile Cookie campaign.
Nice. So
we need to sell 50,000 cookies by the second week in September, which means every dollar raised from selling these cookies, 100% will be coming to Empowerment Squared to support our work. So the link is live. It's on our website, or if you need more information, please reach out to us. But we need your help. We need your support, because this will allow us to serve a lot more newcomer youth and families in this community. We already have a waiting list of participants wanting to be in the program. So this will really help us.
Excellent.
Now, let's go into why you are all waiting. The first series, thank you for those of you who sent us some feedback and some of your suggestions. We've taken them in, and you'll see some of them being implemented. So we'll ask Terry to tell us just a little bit about herself, her background, and the relevance for her to the topic being discussed. I know she said her name, but some of you are still wondering, like, who is this Terry woman? Who is she? So maybe a little bit about her background and how she even ended up here for this conversation.
Okay, so, I'd like to think of myself as an active community member, although much of the work that I've done has been in the background, ensuring a lot of the wheels are oiled and turning well, and I've shied away from being at the forefront of anything really, but by default, I'm here because back in November 2011, at a time in our community when there were some gaps in services or availability of services to newcomers, I had my good friend Haden Ali. At the time, she was a registered nurse, now a nurse practitioner with a doctorate in nursing, had approached me and a couple others in the community to discuss the idea of responding to some of the needs in the community. Wow. And at first we thought, oh boy, that's quite a big feat.
Like we all did.
Right? And we thought it was just a little bit crazy at the time. But we had we underwent a needs assessment, and we had determined that there truly were some needs that weren't met. Although we weren't quite sure how we were going to address them, we knew they had to be addressed. And this didn't mean that there weren't services available, but I think it was around the timeliness of the services, how tailored they were, how accessible they were, given the barriers we knew that existed. And fast forward, I am the executive director of the organization. Yes, I am referred to one of the co-founders, but I truly believe it was a community effort and folks just responding to a need and just garnering the support of the hospital community, learning institutions like McMaster. A lot of our services are led by residents from McMaster.
Amazing.
And a number of great partnerships with local settlement agencies like the Micah House, the Wesley Urban Ministries. These are some of the partners that have really allowed us to continue. Leo, I think it's important to say that a lot of this work is done by the goodwill of the community. So while we don't necessarily like to refer to the services as volunteer-driven, they are actually funded by the clinicians who work there at Refuge, which means that in circumstances where we can bill for the service, they donate 100% of those billings back to running the center.
That's incredible.
Yeah, which then allows me to hire our core staff like admin and your nurse practitioner, your part-time physician, mental health counselors. So we like to mention that because that truly is the core of how we work. So that's how I'm involved, and I quite like the job. And then, and then of course having great partnerships with folks like you, recognizing the good work that you do with the community makes it a little bit easier, right?
Absolutely, and what a nice segue into just showing the importance of our community's effort. Sometimes people look at these agencies and these organizations and think that they're just existing in the vacuum, but they don't necessarily realize what's happening in the back end to allow these organizations to actually function. So for this evening, I'm going to be doing most of the questions, and Terry will be trying her best to answer them.
My best.
And the reason I said her best, because on this conversation, we're not looking for right or wrong answers. We're really trying to make sure people give us their honest opinion, their experiences, their stories, because what we're trying to do is hopefully that someone somewhere out there listening to us may identify with a particular story or a particular experience, and it may help them think deeply about some of the issues they're thinking about as it relates to mental health. So for those of you who may not already know me, my name is Leo Nupolo Johnson. I am the Executive Director of Empowerment Squared, and I will be going through this evening with Terry, who you just heard introduce herself. So Terry, let's get right to the first question for this evening. Can you tell us a little bit about Refuge Hamilton Center for Newcomer Health? Just, I know you said how it was started and the efforts that gone into it, but let's fast forward to today. To now. How is the organization repositioning and situating itself with everything that is happening with COVID-19?
Right. So Refuge, we offer primary care services to newcomers. And at the time we started, the definition of newcomer has really evolved, I should say. At the time, we thought of folks who are within 5 years within Canada, but now we're finding that is a longer period, right? And we've added anyone who's a newcomer to Hamilton who may still experience barriers to access, right? That is key. Because as much as we would like to put a time frame of who is a newcomer, when that person is no longer a newcomer, I think we need to recognize that the barriers are as new as the newcomer or as old as the newcomer. And if we're not able to eliminate or eradicate some of those barriers, that person or that individual has the same experience as someone who may have newly arrived. So it's important that we distinguish that. So Refuge offers a gamut of services, and what makes us, I would say, unique is we operate using the Immigrant and Refugee Health Guidelines, which was developed by a great physician in Ottawa, Dr. Kevin Potty. So it's an evidence-based model of care. And it's probably not a lot of them in and around Canada, but they are becoming more and more relevant and needed, I would say, and available. And we also offer services, subspecialty services like infectious diseases, internal medicine, dermatology, cardiology, hematology. And in the context, and pediatrics, but in the context of what we're speaking to today, the good thing is psychiatry. So we have a psychiatry team. Again, it's a resident-led team in partnership with McMaster University and supervised by faculty. So I think we're very proud that we have these services. And the reason why these services matter, that they're on site, is, again, access. We've found over the years occurs that, particularly around psychiatry, clients may not always show up to that appointment because by the time it's booked, by the time that appointment is booked 6 to 8 months later, which we know that's the wait time, sadly, in the community for these services. Not at Refuge, though, it's a month. Then we find folks feel, oh, I'm better now, so I want access. And whereas these services are on-site, we're finding there's a really good show rate. And I would like to think that it's because of the great work that we do, which there is some of that partly. We really believe it's about where these, who's providing the service for sure.
Amazing.
Because representation matters a lot, but also in terms of the physical space of where that is, right, is also important.
Wow. Now, I kept writing because I'm trying to not forget. We could do the whole show just on this because I think what you do, many people may not realize, but you are providing services, especially to a population that sometimes may never get access to some of these services if not for what you do. But the second piece I would like to highlight as I was writing is that you often hear people talk about lack of capacity in our community, in the Black community, to be very specific. And I often question that because is it lack of capacity or is it lack of investment in people and organizations in our community who are providing some of the most critical services and foundations that keep our communities going? Now, you can say it's up for debate, but I can clearly tell you that sometimes it may not be structured as people expect it to be structured sometimes in the mainstream society. But there isn't a lack of a lot of people making sacrifices. Like you said, these services are all donated by the professionals that come there to work all the time. So that would take me to my next question here, Terry. Now, why was opening Refuge very important for this community, or why is it even such a unique organization in this community? Why, why do you think so? Why did you put so much time and, of course, everybody else that work along to get that happening as well?
I think that's a great question because we hear that all the time. We hear that, well, why can't they go down the street and access a physician there? Or, why can't they go to that other center in the community? Or why can't they go to the hospital? We have a lot of questions, and I really believe it's because there's a lack of, even on our end, we haven't done an excellent job at, to highlight the services we offer. And that's primarily due to the fact that we're underfunded or not funded. So, we're not really out there to advertise who we are in our service until we feel we have the capacity to do that. We recognize that, we should just spend those dollars to deliver the services. But what makes us unique, Leo, is that the timeliness of the service. We know there's a body of literature around, the timeliness of access and how that does change the trajectory for folks. So we like to think immediately post-arrival. And when I say immediately, I don't mean the next day, because we know you have to settle in your home and find a home. But we like to say 7 to 10 days post-arrival is a good time to get folks to know these are the services that are available, that they are in fact available. We have the language support. So yes, there might be Dr. A down the street, but does Dr. A speak the language? Does Dr. A understand the cultural nuances? Those are kinds of the things that make us, I would say, unique. I guess the quality of care is great when it's needed at the time, it's given at the time it's needed, right?
So true.
That's so true, as opposed to, and we take a very preventative approach to providing care, right? So on our first visit, we run the blood work. We know in a week or two what's going on with you, and then we can address the issues at that time, as opposed to you coming to us, a few months down the line when you would have had an issue, so to speak.
Wow.
Right?
Now, you said a few things that I want to pick on before we go to the next question, right? Because people do not realize it, that especially when we talk about mental health. Now I know Refuge provides way more than just mental health services. But since the context of our show is about mental health, is the fact that people don't realize how important it is to have the people you're working with look like you, or have some level of representation,
Right.
even if they're not exactly from the same culture or exactly speaking the identical language. But it's just something comforting
Yes.
to already know that I can talk to this person in a certain way, and I think they will understand me deeper. And they might be able to pick up some of the nuances that I'm talking about.
Absolutely.
Then let's say Dr. A down the street who
Right.
may be very unfamiliar with the context of what I'm talking about and the culture
Right.
of what I'm actually talking about.
Right, that's key. And while we may not have every provider who speaks a language or the language of the person that they're treating, I think even for mental health, because the stressors of just coming to this country and having to settle and connect your children to school, I mean, these are not unique things. Right, having to find home, housing is an issue. Education, connecting finding a job, employment. Those are some of the stressors that newcomers face, and anyone would face.
Absolutely.
Right? But if you're coming, health is not a priority for a lot of newcomers. When they may not have been presented with an issue, right? So if you're coming with a chronic issue, then yes, to seek out some services, or if you've had this in your homeland, then you understand what it is you need to do. But if you've never thought of it, then having to I would say help you to prioritize your health, because we know how mental health does contribute to overall well-being. I mean, that would be a great role, right? We would want to play in settlement.
Our topic for today is pre and post migration trauma, which is faced, especially when we talk about the refugee class or the asylum class.
Right.
Like usually, these are people fleeing from immense violence, sometimes from torture, from war. I mean, you can continue to name.
Right.
The list goes on and on. Sometimes from domestic abuse and violence. Like the list goes on and on. Now, talking about pre and post migration trauma is something that is not factored within the immigration system, right? When refugees are resettled to Canada, during that process, that is not even acknowledged. Talk about being factored, so it's not even addressed to begin with. And the newcomers get here, depending on what issues they may already be dealing with, it starts to manifest itself in many different ways. Now, I'm going to ask you this question. Why is speaking about and addressing mental health important for the newcomer community? And this also includes pre and post as well, because sometimes it is the pre that often lead to the post in many cases.
Absolutely. I mean, we see the benefit to speaking about it. As you and I chatted before the show, it's so many times we feel we're not experts, right? We feel that we're not entitled to discuss some of these issues because perhaps as an immigrant myself, maybe what I faced may not be as dire as what you may have faced. And so we feel that, oh no, it's okay. And if I'm working in a health setting, so I think I know a little bit better, but I'm still cautious that I'm not speaking as if I'm an expert. But what Leo was suggesting is that just the mere conversation around mental health from folks that people can identify with, it is important. It helps us to understand the importance of talking about it so that you can seek help, right, when needed. Absolutely, we understand how culture plays a role in whether we speak about mental health or not. And, it's great that we have a trained team at Refuge who if there are any questions relating to any mental health issue, then I would say let's send us your questions and we'll connect you with someone who can help you. But it is key, Leo. I mean, I've heard you share some of your stories as a refugee, and those stories we've heard in many different variations at Refuge.
Great.
And what the commonality has always been is I came to this country and I thought, oh, this is normal stuff, I really shouldn't be, bothering anyone with it. But I'd say as someone who has seen firsthand the impact of not speaking about things, you should come in and you should speak to someone, and you should develop a trusted team. And that may not always be a healthcare provider, right? That could be your friend or someone you trust.
Yeah.
who you should be able to tell if they have an understanding of what mental health issues are.
Absolutely.
Right? Is that fair?
That's actually, it's very fair. In fact, I would take it one step further and say that the current sector itself, the mental health service sector, people who provide services, it's well documented that it is not representative at all. It is not diverse at all. And this is not being said as a criticism. It's actually being put forth as a challenge. So you have people who are mental health service providers struggling to keep up with the evolving demographic of our community, because they're seeing newer cultures. They're seeing people who speak about it differently, or people who understand it differently, and sometimes it doesn't necessarily connect with the existing paradigm within which mental health service is provided.
Right.
Like you said, the issue of culture. Mental health, I'll speak for my culture specifically, is not something that is acknowledged. It's not something that we know what the context of mental health is. Like I said earlier when we were chatting, when I was going through mine when I just came here, especially from the pre-trauma, I didn't even realize that it was a problem. I was just like, you know what, probably I'm just having bad dreams, or it's just something, so I didn't care. But it was consistent, it was constant. And because I did not acknowledge it, I didn't see any need of seeking help. Now, later on, I developed some other coping mechanisms by myself. But sometimes not everybody might be able to get to the point of developing coping mechanism. And that's why, for me, I think having the authentic conversations about it is also a form of education in helping ourselves understand that, no, you are not strange when you're experiencing these things, or you are not an outlier. In fact, sometimes our society brings about these pressures that lead to things like mental health issues. Zahra says, there is a stigma regarding mental health in my family. What can I do as a teenager to break the stigma and initiate the conversation in my household? I'll take a stab at it, Terry. I'll let you go at that. You're not alone. You're not alone. If anything, I can tell you, I know quite a few people that deal with the same situation. I think it's a very tough situation because in the family, you're trying to not disrupt the harmony that is existing within the family as a result of this. And sometimes there are cultural issues also that are underlying it. What I can say to you, if this person trusts you and came to you to talk to you about it, you can discreetly still have this person seek help without trying to upset your family. I think Terry would speak to that, like at Refuge, for example. There are ways that you can even speak to someone discreetly just to help yourself understand. You are not claiming that you have the solution, but if someone comes to you for help and trust you to talk to you about it, it's because they're looking for someone to help them. So if you don't want to disrupt your family harmony, you don't have to make it a family discussion if you don't feel comfortable. But I still think you can find discreet ways of having this person seek some form of help so that they can understand what they're dealing with. And if there's anything that makes sense to them in terms of assistance, they can seek it. And that includes picking up the phone and calling. But Terry, is there anything?
There's also, for example, if that teenager is in high school, as an example, some of the high schools have access to services. So I know Refuge is part of the Hamilton School-Based Healthcare Network. In partnership with Good Shepherd, McMaster, both school boards, Catholic and public, and the services are available through a nurse practitioner. So that student, say at Bernie Custis and Cathedral as an example, may have access to speak to a nurse practitioner and be able to divulge some of this information and be connected.
So we'll go to the next question from Jessica. And Jessica is saying, Black people tend to use their faith background as a means to cope with stress or mental illness. Is this a sufficient coping strategy? Now, I would personally say, I'm not in a position to say if it is sufficient or not. But I would say to you, if you find faith to be an effective coping strategy, there is absolutely no problem with using that as your coping strategy or coping mechanism. At the same time, we also know that sometimes, depending on what crisis you are in, there may be some clinical interventions that are needed depending on what type of mental health you're dealing with. If it's something like that, I would encourage you, there's nothing wrong with using all of the assistance within your range. If faith is one of them, please do not neglect it because there is another help. But if you realize that accessing more than one form of assistance even makes you better, then I would say avail yourself to accessing all of them. And at the end of the day, my answer would be whatever you find is more effective in helping you deal with it should be what you should make sure you are accessing. Thank you to our funders once again, the Hamilton Community Foundation, the Government of Canada, the COVID-19 Community Emergency Response Fund. That is why we're here. If it wasn't for that support, even our partnership with Refuge, none of that would have been possible today. So we really want to thank that intervention and to the funders for making that available. But again, I can't be here all night. I have to wrap up at some point. So thank you, everyone. And don't miss next week. Set your calendars. Next week, same time, same day, we will be here. And there's another beautiful episode that's in store for you. And don't forget to reach out to us. Thank you, everybody, and have a good night.
Good night.